How to understand urodynamic studies terminology. Imagine trying to solve a puzzle about how your urinary system works. Urodynamic studies are like that puzzle, giving doctors a detailed picture of how your bladder and urethra function. If you're dealing with prostate issues or urinary symptoms, understanding these terms can help you make sense of your diagnosis and treatment options. Urodynamics is the overall term for tests that look at how urine is stored and released. These tests measure the activity of your bladder and urethra, helping doctors find out what's causing problems like urgency, weak flow, or incontinence. Lower urinary tract symptoms are common in prostate conditions, and these tests help pinpoint whether the issue is with the bladder muscles, the flow of urine, or an obstruction caused by the prostate. One key test is cystometry, which involves slowly filling your bladder with fluid through a catheter. As the bladder fills, sensors measure the pressure inside the bladder. This helps assess how much the bladder can hold, how it feels as it fills, and whether it stretches properly. The pressure generated by the bladder muscle during this process is called detrusor pressure. It is calculated by subtracting abdominal pressure, which is measured through a second catheter, from the bladder pressure. This distinction is important because abdominal pressure can change with movements like coughing or straining, and isolating bladder pressure gives a clearer picture of bladder function. During urination, a pressure flow study is performed. This test measures how much pressure the bladder muscle generates while you are voiding and how fast urine flows out. It helps determine if a weak bladder muscle or an obstruction, such as an enlarged prostate, is causing difficulty emptying your bladder. Uroflowmetry is a simpler, non-invasive test that records the flow rate and pattern of urine as you go to the bathroom. While it provides useful initial information, it cannot tell us the exact cause of the problem on its own. Post-void residual measurement is another important part. After you finish urinating, an ultrasound or catheter is used to see how much urine remains in your bladder. A high residual volume suggests incomplete emptying, which is common in prostate obstruction. Urethral pressure profile testing measures the pressure along the urethra, mainly used in women but also relevant for understanding continence mechanisms in men. Symptoms like urge incontinence, where urine leaks out suddenly with a feeling of urgency, can also be linked to bladder dysfunction seen in prostate diseases. For complex cases, videourodynamic studies combine pressure measurements with imaging, showing a live picture of how the bladder and urethra behave during filling and voiding. In the context of prostate health, these tests are especially helpful. Conditions like benign prostatic hyperplasia or prostate cancer can block urine flow, leading to symptoms like weak stream, frequent urination, or feeling of incomplete emptying. Urodynamic studies help determine if the prostate is causing an obstruction or if the bladder itself is weak. This information guides treatment decisions, whether it's medication, surgery, or other interventions. Understanding these terms, such as cystometry, detrusor pressure, pressure flow study, and uroflowmetry, can empower you to better discuss your condition with your healthcare provider. Remember, each person's situation is unique, and these tests are tools to help tailor the most effective treatment plan. Always consult with a medical professional for personalized advice, and know that these diagnostic procedures follow strict protocols to ensure accurate and reliable results.